Okay, any questions?
So with cruciate surgeries,
Yep.
what
Right.
time frame do you actually give them for
Yep.
like full
Yeah, that's a good
exercise
question. So I would normally, after TTA surgery, it depends what sort of surgery I'm doing, but after a TTA surgery, I just say short walks to go to the toilet, that's it, till suture removal, and then I see how they're going at suture removal. These dogs are on Nonsteroidals and all that sort of stuff as well. After suture removal, if they're going well, I might increase their walking. So if they're doing like 5 minutes, I might take it to 10 minutes. It's just making sure they're on the lead. I have to stress that they're not running and jumping and not kind of being careful with stairs and slippery floors, that sort of thing. So I'm quite specific about where they can walk and so on. But I don't, we always do a routine x-ray at 8 weeks post-op, and that's included in my original estimate. So sometimes people say, oh, you charge more for a TTA, but I actually cover, in my estimate, I cover that pre-anaesthetic blood screen, the pre-op, post-op, and 8-week post-op x-rays. So it's a package deal, not kind of the cost here and then add this. So when we do it that way, I get almost 100% compliance to come back for those check x-rays because they've already paid for them. They see it as free. So I don't like to get them back to normal activity until I've done those x-rays, make sure that I've got bone healing. So after about 8 weeks, then I get them slowly over a month back to normal activity after that, if it looks good. Yeah.
Senior dog comes in, we diagnose what I think is arthritis, and then should the vet start them just on medical management and everything, or should we actually diagnose the arthritis with some radiographs at that point? And a lot of debate about whether that's appropriate, inappropriate, giving them an anaesthetic to do it. Should we be doing that as a routine standard of care?
That's a good question. I think you can't make that call without actually talking to the owner about what they want to do. So really sometimes it just comes down to cost, and I don't think it's wrong to make the assumption they have arthritis and just manage them if that's what the owner chooses. I think it's always better to have a diagnosis because every now and then you've got to get it wrong. You know, there's going to be a bone shimmer or there's going to be some other disease process that you might not have recognised just physically. So I always recommend to the owners, it would be great to have imaging, but if you don't want to go down that route, let's just trial it on medical management and see how it goes. But if it doesn't improve, we need to do more imaging at that point. So I recommend it if they don't go for it. Absolutely, if the bloods are normal, I'll treat them like I would any other osteoarthritis case. But the owner needs to know you haven't got the final diagnosis. So if they're prepared to take that as it is, then that's fine. But I think the ideal is to get the imaging. Of course, you may not get the diagnosis on the imaging. If it's got overt bony change, that's fine. But sometimes there's something else going on there, and you can't see it on the radiograph. So it might have neurological disease, it might have a lumbosacral disease or something, and you can't see it. But at least you give the owners the option of what to do. If you're still not getting to the bottom of it and they're not improving, then you might need advanced imaging to deal with it. I don't know if that really helped you because you can't make the call. It's the owner really that makes the call. But I recommend it. Yeah.
This might be slightly off topic, but could you comment on early desexing in giant breeds and the incidence of cranial cruciate?
Now, there's a can of worms. As you probably know, there's a lot of papers and research looking at that. I was always taught that you desex at 6 months of age, and there's a lot of debate now about growth and the effect of that on osteoarthritis. I don't know what the right thing to do is. There's so many benefits from desexing early for other reasons, so you kind of got to weigh that up. I don't know the answer to the question. I still would say desex at 6 months until I have enough information, but I know there's a swell of people might have a comment in here. There's a swell of grand swell of people saying larger breed dogs shouldn't be desexed till they're at least one, and I know some people would stick to that. There's no doubt if you desex before their first heat, if they're female, if you desex before their first heat, you significantly reduce the risk of getting mammary tumours. So, you've got to weigh that up. If they're prone to getting urinary incontinence, if they have sphincter mechanism incompetence, you could argue that one heat at least might reduce the sphincter mechanism incompetence. So there's some argument about that. But about osteoarthritis and growth, there was a paper quite recently, in fact, Brian, who's filming at the back for Vet Talk TV, actually raised that point with me and what did I recommend. And we had a bit of a debate. I sent it around to our medical specialists and surgeons, and we're still debating it. I don't think we have an answer. Nobody really clear. I think there is a problem particularly with early desexings, but I can understand why we do it. animal welfare kind of situation, I think that there's a place for that. But there are effects that we're probably not aware of. I think, a lot of this is, there might be genetics there, but the phenotype, the demonstration of the problem, like we saw with those fat dogs, if you just are really careful with their weight, whatever time you desex them, you can make a significant difference to clinical signs. So you may still be able to do some change to the clinical signs if you desex them, but you're also careful with their weight. So, look, I don't know. It's multifactorial, and I don't know the answer to that. But on that point, talking about Vet Talk TV, and I'll probably mention this later because you see some videos from them, we have the privilege of having worked with Brian and Kay from Vet Talk TV, and they do videos of most of our talks at ARH, but also procedures. So if you want to see, surgery on something, or how to manage birds or something, we have all these videos. If you go to Vet Talk TV and sign in as a vet, you can see a lot of educational videos which are free. You just have to log in, but it gives you access to a whole lot of teaching information, and great. And also your pet owners can look at it, because we have pet-friendly, owner-friendly video that has less blood and gore. But for those who like blood and gore like me, there's some kind of nice images of surgeries and so on. So just a little plug if you want to log on to Vet Talk TV. I don't think there's any point in using nonsteroidals as a preventative. It doesn't work like that. They're really just there to make them feel better. I definitely think the nutraceuticals and the chondroprotectives are worth doing as a prophylactic thing, but nonsteroidals really should only be used to manage pain or lameness. I don't think that they have a prophylactic effect or preventative effect. I would concentrate on exactly what you said, the weight management and the chondroprotectives and the nutraceuticals, because there are risks of using a nonsteroidal. I mean, it's not an inert thing, and most clients feel like that too. So I find most clients are really reticent to use them frequently because they have potentially bad experiences, or they know of people that have bad experiences with nonsteroidals. So in general, I try to only use those when I need to, or lower doses if they're longer term for that. Just for safety, really.
Just on the evidence-based medicine, we had a specialist in Melbourne who wouldn't recommend Pentasan because he said there was no evidence that it did anything.
Yep.
And I noticed in your talk you'd mentioned magnetic beds and acupuncture. It's hard as a vet to know when do you recommend something because you believe it works, and when should you only recommend something because the evidence says it does something.
That's a good question. I don't tell clients to go and get a magnetic bed or acupuncture, but if I have some clients who ask me about it, I go, if it works for your dog, use it. I don't have a problem with that, but I'm not out there selling them, and I don't do acupuncture, and nobody in my clinic does. But if somebody asks me about it, I go, yes, I've had clients that have done that on their pet and it made a difference. I don't know if it works, I don't know why it works. So I'm out upfront, and it's the same with stem cells. Somebody says, I really want stem cells. I go, I can do it for you, but I can't promise you it's going to work. I don't have the scientific evidence to say that it works. So I tell them that. Penisin polysulfate, the reason I'm happy to push Zydax is because they have done the FDA approval process. They've had 540 dogs or something. I can't remember exactly how many dogs, but they put them through all of the class 1 level evidence to get that. So they got better than placebo-controlled improvement in these dogs that was assessed in multiple different ways. So I'm happy that they've done the research and they're the only one that has done FDA approval. So I'm happy to push that because I think the evidence is there now. It probably wasn't, I don't know who was saying that, but right, yeah. So and pre-Zydax too, because they've actually improved the product as well. So if somebody's willing to do the research, like Hills and Metabolic Plus, I'm very happy to get up. I know people say, oh, why do you get up and promote a product and some company? I'm happy to do it if I believe in it. If I think it works, if I think they've done the research and they've got scientific backing for it, I'm happy to say it works. If I use it, I'm happy to say it works. I might end up on an ABC program telling me that I shouldn't have recommended a diet, but I don't care. I think it works, and I use it in my own pets. So, I think that that's the point. I'm happy to promote something if I think it works. And there's evidence to say that, not just anecdotal. Yeah. So it's a good question. Cats and osteoarthritis. So I would still use a penisin polysulfate product. I would use Zydax off-label and they are working on registration on label. But again, you have to notify the client that that's what you're doing. So I think plenty of people have used a Penison product on cats and used it in the same way, same dose as the dogs. I think that you just have to have notified the client that it's off-label and you're doing it like that, and they have to be okay with that. I do use meloxicam mainly as a non-steroidal in the cats, and in my own cat that has borderline renal disease, I have to reduce the dose of meloxicam. I just use a low dose and monitor the renal values. But it's harder to get compliance, I find, with clients because they often don't tell if their cat's better or worse, and they can't really see a change sometimes. So I do see a change in my cat when I use those things, but I think I would do kind of, the weight management, the use of non-steroidal is safe in cats. The meloxicam I've just used longer term. There are obviously other Onsior you can use, for the cat. That you have to pick the ones that are safe, but longer term, I think the only studies that I know that are long term, usually lower dose, is meloxicam. Nutraceuticals, the Hill's joint diet for cats is available. It's not mixed with the metabolic, so if you have a fat cat, you'd probably better to stick with the metabolic. And there are other kind of additives that people, cat ones that you can use for nutraceutical benefit. But I think you do the same sort of thing. There are some limited options, though, you're right.